Okay, so morning updates. We're going to talk a little bit about calcium supplements and heart attacks. We like calcium. We like calcium in your diet. We think it's good for you. On the other hand, too much calcium is bad. So we sometimes get people coming back and they're taking Tums and they're taking calcium tablets. And there's a recent article showing that the ideal form of calcium is calcium that's in your diet. So yogurt is a better choice for you long-term as a source of calcium than is the calcium pills. And if you decide we want you to take Tums, if you take Tums, we want you to take it in moderation and not kind of take tons of it or something like that. So there's recent research that if you take high doses of oral calcium supplements and kind of overdo it, you can actually increase your risk of heart attacks. So we want you to take calcium. There's a decrease in calcium absorption with the surgery, but don't overdo it. And so we want to give you that update. We'll let you know that on our Facebook page, on our Twitter page, and on some of the other things, our blog, you can keep track of these kind of latest updates that are important to you and your surgery. So obviously not everybody who's ever had my surgery is here this morning. We're recording this video. We've kept track of that whole detailed article so that you can look at it. So we recommend that you do keep up on those things. And it sounds a little goofy to me to say Twitter and Facebook, but on the other hand, it's a nice tool for you to get the latest. The problem with our web page is this kind of big amorphous mess, and it's hard to tell what's the latest stuff that I would like you to read. And the nice thing about the Facebook and Twitter and our blog where we keep track of things is you get the latest stuff as it comes off the presses. Every day, all I do is think about this surgery, and I read and try and stay up to date on the latest. And you can get a feed, update of that information by simply logging on and joining one of those things and following those updates. So we recommend that to you. And the latest one is that one. Another one that just came out is a long research study of 84,000 nurses. And they watch their diet now for almost 10 years. And basically, a lot of us have kind of heard the research that high amounts of red meat in your diet is not good for you. We've heard things about heart attack and cancer and things like that, and this study confirmed that. But basically, really high intakes of red meat increase the risk of heart failure and heart attack in this group, and a little bit more fish and chicken, things like that, give you a lower risk. So one of the things, again, that we just published on the updates is that information. Kind of goes along with a lot of things we've seen. Another research topic is the high fructose corn syrup business, the stuff in the soda pop and things like that. And there's another new article that just came out talking about the increased intake of that is associated with an increased risk of obesity. And so we have that and a couple of the others. So we'd like to encourage you, again, to stay up to date. You can get the latest things. We were talking with one of our patients a few minutes ago about Prilosec. Prilosec is a foundational drug. We use it a lot. And many millions of people around the world are using it every day and are planned to take it for the rest of their lives. For the first 10 or 15 years, I think generally we concluded that Prilosec was essentially 100% safe. And now we found, no, it's not 100% safe. There are some risks in it. Now, it seems like the risks are pretty low, but basically they found three things that you want to know about. And again, this stuff is all detailed on the online services that we mentioned. But just as an example, there's a study that showed that if you take Plavix for your heart, the Prilosec may interfere with the good effect of the Plavix. There's another study showing that if you take Prilosec for a long term, you make the acid content in the stomach lower. It's an antacid. When you do that, you set up two other issues. One is you absorb less calcium. And so it may contribute, if you take it for a lifetime, to an increased risk of osteoporosis. Another problem is that if you change the pH and make the stomach less acid, it could potentially let in a bad bug called Clostridia difficile, which can cause a real serious infectious diarrhea. So we give Prilosec to our patients. We give it for a pretty long term, for months to a year or so, and sometimes longer. We want to discuss it with you if you go beyond a year or so, because there are some risks to it. Meanwhile, many doctors have made the determination that those risks are pretty small and are going to give it to their patients for life. What we'd like to tell you is probably it's safe, but again, you can keep updated on the latest by staying in touch with us.
Does it matter if you switch back and forth between like ranitidine or, you know, those other kind of drugs?
Well, some of the data I've seen suggests it's not the drug itself, it's the fact that it makes your stomach less acidic. The acid environment of your stomach helps kill a lot of bacteria and get it sterile, and that's a good thing. On the other hand, if you have too much of the acid, it can get into the lining of the stomach and cause an ulcer. So, like everything, you're trying to balance the good with the bad, and I don't know exactly whether or not there's any research on Tagamet, ranitidine, Zantac, Pepcid, and those H2 blockers. The guess is if you do anything for a lifetime to kind of affect the gut, to affect the body in any way, you may have some risks. And I'm just guessing if you lower the acid content in the gut for a long term, I bet you're going to have some issues if you do that for somebody's lifetime. Because the way God designed it, you're supposed to have some acid there. And so calcium absorption will be affected, and probably the ranitidine and drugs like that might make a difference. Now, one of the things about the H2 blockers, ranitidine, Pepcid, Tagamet, and drugs like that, is they're not as powerful. So you may have more of the day in which you get some acid in the stomach. And so ranitidine or Tagamet at nighttime is very effective. Maybe during the day a little bit of extra acid while you're eating food and things like that might not be so bad. So there might be some things to negotiate, but I haven't seen research about that.
So I found sometimes at night that I have to take Zantac because it just feels
that kind of burny, upset.
And I can sleep better.
Yep. A lot of people, when you see people on maximal therapy, there is an argument that nothing adds to the Prilosec. That Prilosec eliminates all acid, and so adding to that doesn't make any difference. There's some other data, I think, that suggests that might not be right, and a lot of people, when they're treating every bit of acid, will use an H2 blocker at night like you described. And so I've heard that a lot, and it might be a good thing. Okay, so that's the latest updates.
And that's only occasional.